Hi, I'm Dr. Tom Hendrickson, and I want to show you a basic protocol for treatment of the lumbar spine. First of all, you notice I have Jill in the sideline position, fetal position, knees up. So this opens up the joints of the low back in their open position. If your patient or client is on his or her belly and you push down, you're closing the joints down. That's why we have the body in the sideline position. So I'm going to do three different things here. I'm going to do soft tissue mobilization, joint mobilization, and muscle energy technique. So I'm going to begin by rocking the body, and Jill's body rocks easily. Some patients have a little trouble rocking. Just do it very gently. And then as I'm rocking, you'll notice I'm going to have my hand here. My wrist is in neutral position. My hand is relaxed. And so I'm going to push into the spine, posterior to anterior this way. So this is joint mobilization. This is posterior to anterior mobilization of the lumbar spine. So the health of the spine is induced by cycles of compression and decompression, like what happens when we're walking. And that stimulates the lubrication in the spine. So that's why this technique, we're compressing the joints and then decompressing them, stimulating the lubrication deep within the spine. So that's the first thing. You'll notice I'm rocking her whole body rather than just localizing it to this one spot. And then I'm going to use my thumb on my supported hand here, supported thumb position rather, on my hand, and I'm going to scoop into the tissue and I'm going to move it from medial to lateral. There's a positional dysfunction of the muscles of the spine, the erector spinae, where they roll into the midline. This is a concept from Lauren Berry that soft tissue has positional dysfunction. We want to broaden the back. So I'm going to sink into the tissue and I'm going to scoop to the side. If you saw this in a big picture, it'd be like sinking in and rolling through this way. So now we combine those two. I'm going to sink in and roll to the side as I'm mobilizing the low back. Pressing in posterior to anterior, right next to the spinous process, sinking in and then rolling the tissue to the side. This broadens the fibers, allows for better function, better mobility. If the musculature is very tight, we can do one more thing. This is a muscle energy technique, a contract, relax. So I'm going to have Jill straighten her leg. I'm going to have her resist as I push forward, so go ahead and resist me. Now this should not be painful at all for about 5 seconds, and then have her bring her leg back on the pillow. I can have her resist as I pull down a little bit. That's called reciprocal inhibition. It turns off the muscles of the back. And you'll see after you do that, the muscles will be in a more relaxed state. So the relaxation follows the voluntary contraction. And you can go all the way up with this technique. Posterior to anterior mobilization combined with soft tissue mobilization combined with muscle energy technique. And that's the basic protocol of Hendrickson Method for the lumbar spine.